Welcome to The Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm Dr. Andrew Wilner, and today I have a special guest, Dr. Paul Gross. Welcome, Dr. Gross.
Thank you, Dr. Wilner. It's nice to be here.
So, Paul, I invited you today, and thank you very much for taking the time. It's a Saturday, it's April 18th. We're in the midst of COVID, but we're going to talk about a topic that I think is very enduring, and that's the arts of medicine, the humanities. And you are the editor-in-chief of Pulse, which is an online magazine. I want you to tell me how you got there and why Pulse is important.
So Pulse is an online publication. Our official entire name is Pulse Voices from the Heart of Medicine. And you can find it by going to pulsevoices.org. And it got started because I felt years ago, actually starting as a medical student, a disconnect between what I was learning in the medical school classroom and what I saw when I went out on the wards. And while I learned some very important things in the medical school classroom, I learned about the science of medicine. I found that trying to apply that science in the wards and then later on as an attending physician in the office was very, very different. What was in the journal and what I experienced in the office was very, very different. And so I found that writing about medicine, writing about the experience of medicine and getting others to write about the experience of medicine was actually an attempt to get to the truth, the whole truth of medicine, of which the science is one part of the truth, but the human aspect of it is, to my mind, was actually a larger part of the truth. And so that's how that was the incentive for starting Pulse. And I had the great good fortune to be hired by the chair of the Department of Family Medicine at Montefiore Medical Center, Albert Einstein College of Medicine, who, when I told him I was interested in starting a publication to explore the human side of medicine, was very, very supportive. And what emerged was Pulse, which is this a weekly publication where every week we send out a first-person story or poem about giving or receiving healthcare. And it could be written by a doctor, by a nurse, by a social worker, by a patient, by a caregiver. And that's what he has evolved from that idea.
I should probably divulge that we're kindred spirits. Ever since medical school, I've been writing creative nonfiction and published in the Annals of Internal Medicine. You know, they have a slot for poetry and creative short fiction. I contributed to a book on Alzheimer's disease a long, long time ago. About having a parent. I don't personally, but I wrote a story about patients that I had with Alzheimer's. And so I agree. I think we talk about the medical arts, right? So, but why is this important? Why does it matter?
That's a great question. And I think, one, we can ask ourselves individually, does it matter to me? And, why, if I pick up the JAMA, why do I turn to a piece of my mind first? Why does that grab my attention? And I would ask your listeners, does it matter to you when you pick up a journal and read a story by a physician who has struggled with a diagnosis or struggled with with a situation that didn't go quite as well as they would have hoped for? Why does that resonate with you, and why do you read it? I think it's particularly important for students, and I say that because my philosophy is that we want to train compassionate physicians. And how do you train a compassionate physician? And do you train a compassionate physician by stuffing somebody's head with facts? And I think of when I go to a doctor, what do I want in a doctor? I want a doctor who listens to me, who is a human being, who is smart, who knows something about medicine, but who's also willing to listen and hear what I have to say. And so if I want to train somebody to be that way, how do I do that? And my thought is the way you train somebody to be that way is to train them that way, is to train them to be in a compassionate way, to train them in a non-judgmental way, to train them not to be afraid of their own emotions and their own experience. And I think too often in our medical training, we don't give them space for that. We tell them to be compassionate. We tell them these are the questions that you need to ask to, to elicit information from people. We tell them don't be judgmental, but we do it in a very judgmental way. And so I think of writing and the humanities as a way of opening ourselves to our students and to say, how is it for you? How is this training for you? What's happening to you as you go through this training? How does it feel? What are you struggling with? And doing it in a very non-judgmental way so that they can be unafraid of their own emotions. And then hopefully when they go into a room with a patient, they can bring their whole selves into the room and be a listening, compassionate, non-judgmental physician, which I think we all would think of as being the best possible kind of physician.
I know in my day there was very little acknowledgement of this. There's certainly no formal courses in medical school about writing or the humanities. And in fact, many physicians, I remember I had an interview when I was trying to get into medical school, and I told the physician, who was a local guy, and successful in practice, of how, I really wanted to learn medicine so I could learn more about people and I could write about them better. I got a terrible, terrible recommendation from this guy, and I did not get into that medical school. That was kind of my first. It's like, geez, not. I just assumed that all physicians were kind of Renaissance men and enlightened, and I discovered that that's not the case. So, does your school offer a specific course? Can they get course credit for learning about the humanities?
Well, I'm actually very fortunate in that a number of years ago, I was asked to participate in the orientation of students at Einstein. And so actually in their very first week of orientation, I get to talk to the entire class. And I posed the question to them, what does writing have to do with medicine? And I assume that, my assumption with all of this is that people are skeptical about. So that's how I'm willing to put the question on the table. What does this have to do with medicine? I read them a story that appeared in Pulse many years ago, a wonderful story called My First Patient. And I suggest to them that I draw the analogy between if we were 200 years ago sailing from the other side of the ocean to the New World, how would we know that we were heading in the right direction? And these students actually create their own oath during this orientation session. And I say to them, that's your goal. That's what you want to get to. You want to be this compassionate, caring physician. How do you know that you're getting there? And how do you take stock of yourself as you're getting there? And I suggest that one way is by writing and by asking yourself, how am I doing? Am I getting closer to my goal? 200 years ago, if you were sailing across the ocean at night, you might go up and look at the stars and use your instruments to shoot the stars. This is a way of doing that. This is a way of keeping track of how you're doing and checking in with yourself. I talk to them actually only for about 25 minutes, and then they divide into small groups led by a faculty facilitator. and they all do some writing and some sharing of the writing in the hopes of, first of all, normalizing the idea of writing and putting their thoughts and feelings down on paper, and then normalizing the idea of sharing it with one another, and introducing the idea that in doing that, they are actually teaching one another. They are saying to one another, this is what it's like for me, and I'm going to share it with you, and I'm going to trust that not only that you're not going to laugh or make fun or put me down, but that actually this is going to help you, because one day you're going to experience something similar to what I'm writing about, and it's going to be a comfort to you to know that somebody else has been through the same thing.
Yeah, that's great. I think, when you look back at sort of the role of the physician over the last, 5 to, 25,000 years of humanity, they didn't have a whole lot to offer. And so, no antibiotics, no surgery that was successful most of the time. So what were they offering? They were a presence, they were compassion, they were hope. They offered these human qualities. And now, there's a tendency, you go to a doctor, you've got some, incurable condition, and the guy goes, well, I don't have anything for you. End of consultation. And it's true. I mean, from the point of view of he's looked in, all the treatments, you've done this, you've done that, that's it. So, but you really, people need more than that. I mean, they need that. They need to know the reality, but they need more. And I think physicians aren't, there's no billing code for that, for compassion. And I held his hand, and we talked about the meaning of, where to go from here. That's not really rewarded in any tangible way. It's so personal. But if you could, there ought to be a slot for that in the template.
Well, and it's interesting, Andrew, that you're talking about a couple hundred years ago. What did doctors have to offer? As we're recording this, we are in the midst of this COVID epidemic, and I am doing a lot of outpatient telephone medicine, and I find myself in the same situation as doctors 200 years ago. I have patients who are at home who, by their symptoms, seem to have COVID-19. And what do I have to offer them? Do I have an antibiotic to offer them? I don't have an antibiotic. Do I have a cure to offer them? I don't have a cure to offer them. What do I have to offer them? I offer them sleep on your stomach. I offer them, if you have pain, take Tylenol. I offer them, make sure you keep up with your fluids. Maybe I have, if it seems like there might be an asthmatic component, I can offer them an inhaler. Um, I don't have a lot, but what I can offer them is, I'm here with you. I'm going to call you back tomorrow. I've been giving out my cell phone number more than I usually would do. And if things take a turn for the worse, call me. Here's my number. Uh, and I, I have to believe that it actually makes a difference. That people, knowing that there's a doctor there who you can call, who will answer your call, who's concerned about you. I believe that makes a difference. I don't have a study, I don't have a randomized controlled study to show that, but I do believe it makes a difference. And it certainly makes a difference to me as a physician. It makes me feel like I'm doing something. Although I must say, I also feel very inadequate to the task. And I have to hold those two things together. I'm inadequate because I don't have a cure to offer, but at the same time, I'm offering the best that one can offer, and that does feel gratifying, particularly when patients start to get better, and that seems to be happening at least a fair amount of the time.
Right. So let's see. Well, I'll tell a story. When I was in medical school, there was a very popular surgeon, and we shadowed him as I think second or third year student. And he said he gave out his cell phone number to, I guess his home number must have been in those days, no cell phones. Gave out his home number to every single patient.
Yeah.
And one day somebody asked him, Dr. Fetter, you're giving away your home number. He said, it's okay. He said, no one ever calls. He
Huh.
said, they're happy that I give them their number. He said, then my number, but no one ever calls. And, it was the gesture. It was saying, I'm here if you need me. I'm sure, once in a blue moon, somebody might actually call, but it was the knowledge that he's there was much more important than the actual call. And he realized that.
Right. Well, I must say that in my career, I I have given out my number to people, and unfortunately, I end up getting calls about renewing prescriptions, which maybe a surgeon would not get, but I do get, and so I am somewhat judicious about giving out my number, but in this case, I think it's when people are with this illness of people taking a turn for the worse very quickly, I feel like it's something I should do.
Yeah, I would stress that I think as a physician, I feel compelled. I read probably every day. I've been working on, I'm a neurologist, so I'm working on the neurologic complications, of COVID, because there's been a lot of reports. Almost every day there's a new case report. I just published a summary on Medscape yesterday. And no sooner did it get published that there's a new report of Miller-Fisher syndrome in two patients. So I'm going to read about that this afternoon. So I think your obligation is that you are at state of the art. And then you tell the patient, look, I know what's out there. I used to have patients come to me and say, oh, Dr. Willer, look at this newspaper article. There's this new treatment. It's like, well, you think I don't know that? You think I don't know that? I don't read the paper. I mean, come on. And I know about this stuff. That's your job. And then if there's nothing tangible to offer, concrete, then the compassion, I think, is really all you have. And it's an important tool. And so writing is a way to sort of get in touch with that.
Writing,
What's going on beyond you have pneumonia, you're 75 years old, 40% chance you're going to die, 20% chance you end up in the nursing home. Maybe you'll get better. I'll see you tomorrow. You can do better than that, right?
yeah, yeah, and the writing is a way. It's many things. It's a way to unburden ourselves. I conduct writing in my professional organization. Which is the Society of Teachers of Family Medicine. I conduct writing workshops, and I've had writing workshops where somebody will write a piece and they'll say, "Oh, this happened 20 years ago when I was a resident," and they'll read the piece aloud and they'll start to cry, and they've been carrying this around for that period of time, and it's uh, I can't help but think that there's something therapeutic in that. In addition, there is something about writing as an act of education, of teaching others, here's what I did, here's where it went wrong. And it can be a medical thing, but often it's I did the best I could and I made a mistake, or I did the best I could and the patient was going to it was just beyond what we could do, and yet it felt really bad. Or I had this conversation with the family and it was really hard, and I tried my best, but the family and I were just on different pages. So and I think that it's helpful to read of other people who are having the same struggles, and it's helpful for students to read that, and then it's also helpful for patients to read that, to see that we are made of clay just like they are, and we're struggling and we're human, and behind our stethoscope is not a computer, is a human being. And for us to read about what patients are going through, and to walk a mile in their shoes, and to see what it's like for them when they encounter a physician who is unfeeling or blunt, or says something that without thinking, that they're carrying around with them for years. And I mean, I I have type 1 diabetes, I came down with it when I was a first year medical student. Do you know who gave me my diagnosis? The receptionist in the student health waiting room. That's who gave me my diagnosis of type 1 diabetes. And I carry that around with me, and I think when I have to give a patient bad news, that's what I think of. I want them to have a more compassionate experience than I had.
Yes, I actually can relate to that. I had a call from my doctor's office. Oh, Dr. Wilner, we just wanted to give you a report about your chronic renal failure. And it's like, I don't have chronic renal failure. It was a lab error. And we're just following up on your chronic renal failure. I was like, whoa, is there something I don't know? And, a sensitivity, as you say, we are made of clay, or maybe something not even as tough, as clay. And these presentation matters, right? It's not just what you eat, right? Presentation, you go to the restaurant, they try and make it fancy. It tastes better. We're susceptible to those things. Well, tell me more about Pulse. Suppose I've got a story in me and I want to send it to Pulse. I mean, is there any chance you're going to publish it, or who reads it, or how does that work?
So if you go to our website, again, pulsevoices.org, um, we welcome submissions from anyone, and we get submissions from all over the world. So we welcome submissions from health professionals, from patients, from caregivers. Essentially, we have, in terms of stories, we have sort of two kinds of stories. One is our every Friday story. We send Pulse out every Friday. Those stories are about 1,000 words. It needs to be a real story. We do not run fiction. So it needs to be a first person story. So it's something that happened to you and written in the first person. And if you look on our website, you can see how to submit. It's fairly easy to submit. So those stories are about 1,000 words. We also have a section called More Voices, and every month we introduce a new theme on a variety of. This month's theme is COVID-19, obviously, but will have the waiting room, getting bad news, all kinds of themes related to healthcare. Um, and those are shorter pieces. Those are 40 to 400 words. So if you have a very short piece, again, go to our website, go to More Voices, you can see how to submit. The nice thing with that is that there's no timestamp on that. So if you see a theme from 3 months ago that you say, oh, we had one on, animals, I want to write something about my therapy dog. You can submit a piece on that. We accept poetry, but there our submission window is usually November, December. Haiku, in October, we accept submissions for haiku. We also can use visuals. Every other week, our story comes out with a visual. Every other week, it comes out with a haiku. So if you have visuals, photographs, they don't need to be of something medical, but there needs to be a medical theme. So if you were recovering from an illness and you were looking out your window at your garden and you took a picture of your garden and it was informed by your illness recovery, that would be a wonderful thing to send to us. And all of these you can find, information about all of these you can find on at pulsevoices.org.
And every now and then you publish a collection, is that right?
That's right. We have three collections, three anthologies of pieces that have appeared in Pulse. They are wonderful. Obviously I have prejudice, but I should say that all of our stories are edited, so they're not. It's not a blog, and everything that is submitted, gets reviewed. So we don't run every single piece that we receive, and they're tightly edited. Our editor is actually the former senior editor at Town and Country magazine, a really wonderful, wonderful editor, and works closely with authors. So even if you don't think of yourself as a great writer and you say, but I've got this story, and you can put it down in 1,000 or 1,200 words, send it to us, and our editor, will work with you to get it into shape if we think it's got a lot of potential.
So one of the issues with the arts is there's often, it's a lot of work to do one of these things. Where, where does compensation fit in for the submitters and the workers, behind the scenes like this editor? Is it just a labor of love for everybody?
That's a wonderful and fair question. So I've had the good fortune to work for a department chair who's actually given me some administrative time to work on Pulse. It's not enough time. I spend more time on it but still, he's given me some time, which I'm incredibly grateful for. It is free to subscribe to Pulse. So when you sign up for Pulse, it's free. We do periodically send out an appeal for funds, and we have a I should be wearing it. We have a Pulse T-shirt. If you give us $60, we'll send you a T-shirt, or we will send you one of our anthologies, or we will give you a subscription to a wonderful magazine called The Sun. So that's how we raise money that way, and we get some money that way. Enough. We have two poetry editors, we have a visuals editor, we have a haiku editor, we have two more voices editors, and we have our executive editor who edits all our stories. Our executive editor really spends a lot of time and probably spends a good 10 hours a week working on Pulse, editing, stories. So she is compensated. I should say she is undercompensated, but she is compensated. And we also have a web developer who makes sure, people try to hack our website, believe it or not, and he makes sure that our website stays up and functioning. I should mention that if you go to our website, we're in the process of launching a new website very soon, which is going to be just lovely, and we're very excited about that. So that's coming in the next couple of months.
Paul, I've really enjoyed talking with you, and I want to thank you for telling us about Pulse and the importance of the humanities. I'm going to put these website addresses on the video so that people can see them. And for those who are listening on the podcast, just tell us again where to find this.
It's the name of the publication is Pulse: Voices from the Heart of Medicine, and the website you can find by just going to pulsevoices.org, just like it sounds, pulsevoices.org.
.org. That's great. Well, thanks very much for joining me today on The Art of Medicine.
It's been a real pleasure. Thank you for the opportunity to talk. It's been great.